All right, ladies and gentlemen, we are here at our program again. Aonasia with Mr. Jollof. Today we dey discuss on health sector in Delta State, and we deal with our Ogbologbo, the Commissioner of Health for here. No other person but Dr. Joseph Onojaeme, right?
Onojaeme, yes.
Yes, sir, I'm correct. Yeah,
Yes,
well done,
you
sir.
are
Thank you,
correct.
sir.
Yes.
So, sir, without wasting much of your time, we want get a little talk because we see so many activities where they go around your sector, how you
Yes.
dey go around to make sure say we advance our health sector in Delta State. Yeah. So far so good. How have you been able to advance the health sector in Delta State since you've been in the cabinet with His Excellency Right Honorable Sheriff Francis Oboroi?
Okay, I want to thank you, Mr. Jollof, for that question. I would just scratch a tip of the iceberg.
Yeah.
The truth is, since inception, we've done our way. We've done a lot to reposition the health sector in Delta State. Like when we came in, we noticed that the state government is paying a lot of health workers that have jackpot out of the system.
Yeah.
Over 200 health workers were fished out and their salary were stopped in September 2023.
Wow.
So, and that now gave room for replacement of health workers.
Yeah.
There was now space.
For people to
there was
come
now
and work.
money available to pay those who are ready to work. Yeah. If you look at in only Delsuit, 200 health workers, both doctors, pharmacy, nurses, and other health workers who traveled out of the shores of this country
without notice,
that are earning in pounds and they are still receiving their salary in naira. Those workers where their salary were stopped, so that now gave the state government space to replace them.
Yeah.
So we solve a lot of human resource for health with that singular action. And that thing boomerang into other health sector, like in the hospital management board, a lot of workers who did the same. Yeah. They just put in their resignation. So that fear came into the health sector. So currently now, we have the state government is paying workers who are working, who are putting in
not ghost workers.
Yes, not ghost workers.
Okay, now.
So that one is one of the things we did. Then in the School of Nursing, there were a lot of complaints of money collection for score, money collection for admission and all of that. We repositioned that too. If you are following keenly with what is going on in the health sector, you know that currently, if you read your book in any of the school, college of nurses, we have nursing science we have in the state. We have about 5 college of nursing science. The one at Asaba, the one at Saple, Warri, Eku, and Agbo. So if you notice, student now, they write exam and they pass, their result will come out within 24 hours. They can see their result, and those who pass knew deeply that they read and passed their exams. Those who fail, they know fully whether they failed that exam. So that is on the aspect of health education for our health workers who are training in the state. If you also look, the medium and low cadre of health workers, we have serious shortage, especially in the primary healthcare sector. Primary healthcare, we have about 441 in the state. So we actually have the major problem we have in the primary healthcare is human resource for health, and it's the middle and low level health workers that are running this primary healthcare majorly. So we notice that the only college of health technology we have in the state, which is domiciled at Ofoma in Ughelli North, is not enough to train the required amount of health workers we need in the state. His Excellency, in his good wisdom, decided to establish the College of Health Technology Ovrode. which as I'm talking to you now is 80% completion. So I know that in the next 2 months, that facility
Will be
will
running.
kick off in NS. So that is one of the things. In terms of equipping of hospital in the state, including primary, secondary, and tertiary hospitals, His Excellency have done seriously well in that aspect. If you look currently now, there is no dialysis unit in Asaba Specialist Hospital. As I'm talking to you now, His Excellency just approved the setting up of a new dialysis unit in Asaba Specialist Hospital that have water treatment plant and so many dialysis machines. Because in the dialysis unit, you cannot set it with only one machine, because you are taking care of infectious patient like the retroviral patient, okay, and the non-infectious patient. So you can't use the same machine for them. So to set up a dialysis unit, you must get more than 4 machines.
Multiple equipment.
So which is so when I tell you His Excellency set up a dialysis unit in Asaba, at Asaba Specialist Hospital, is not a small work. So it's something that will be encouraging. It's something that will help Deltans. If you look now, a lot of, because of drug abuse and consumption of fake drug, you saw NAFDAC going around to close down market where they are selling fake drugs. A lot of people are coming with renal failure. So because of that, you find out that many people, not just in Delta State, across the country, are coming down with renal failure. So and when you have renal failure, you need a specialized center that have a dialysis unit where they can easily get dialyzed at an affordable rate, well subsidized by the state government. And not only the setting up of dialysis unit in Asaba Specialist Hospital, His Excellency also strengthened the existing 2 units we have in the state. The one at Central Hospital, Warri, he bought additional, the ministry, with the help of His Excellency, procured additional 2 units for the one in Warri, then several units in the one at Del Sutogara. So on the aspect of equipping of our hospitals, including primary healthcare, secondary healthcare, we've done a lot of work. And also, worthy of note, the last 10 years, we don't have a functioning CT scan machine in Central Hospital, Warri. In Warri, we don't have at all. In Del Sutogara, in the last 10 years, we don't have a functioning CT scan. As I'm talking to you now, His Excellency approved the procurement of 2 brand new CT scan that is manufactured, is a German machine that is manufactured from scratch. The one at Del Sut have been delivered, so I think they would install it this week. The one in Central Hospital, Warri, will arrive in the next 1 or 2 weeks. So His Excellency have done a lot in the aspect of equipping, improving the healthcare in the state. Just look at it. Look at where we are now. Look at where we are coming from. You agree with me that there is great improvement in the health sector?
Okay. Last week we made a post because as regards to this Delta State Contributory Health Commission,
Yes.
where from 0 to 5 years is free medical for children and for women as well, for delivery of kids. Now, when we made that statement, I can practically tell you that I went to Warri General Hospital, and some rumors that were going on there was that the administration have scrapped that. And luckily, I called you that day when you said, go to the Delta State government page and see what
is there?
you've shared there. And when I made that post, some people came up with some complaints. Some said the moment the drug is above 2005, they refer them to a pharmacy outside the hospital. Some were complaining that the cleaners, especially in Warri General Hospital, that the cleaners there, they work sometimes 3 times in a week, that they don't work 7 times the 7 days in a week. They don't work there. They just work. Sometimes they work only in the morning. They don't work at night.
Okay.
And I went there myself on Saturday. There, I noticed the state that it wasn't that touch the way it's supposed to be. Now, some people were showing receipts that they pay for this, they pay for that. I noticed a lady that had a premature baby, and she said for incubator, she's paying for that. For oxygen, she's paying for that. I think 2,000 naira for incubator, 3,000 naira for all of that. So what the question is that is Delta State paying some money or part payment for the free healthcare, or they are paying like for the whole treatment? Is there a particular treatment they pay for, or they pay for everything? That's what we want to know.
What I want to say is that if you look at the health indices that the Federal Ministry of Health just released, I will share with you. You will see that the health indices in terms of under 5 mortality rate and maternal mortality rate have improved greatly. What that means is that the number of children who are under 5 per 1,000 live deaths have dropped. The number of women who are pregnant, who die through the process of delivery has also dropped. The mortality rate have dropped.
Sorry, I will also comment. I also commend the M.O.R.E General Hospital too for having good delivery system there.
Yes.
Because the person that had what's it called, premature delivery,
Yes,
she went to a private hospital.
Yes.
And they said she should go for CS, which she refused because she was scared of CS. And she went to M.O.R.E General Hospital
and she delivered
normally.
Yes.
So the only complaint they were complaining about is that why are they paying when the government is supposed to pay for this?
So what I'm saying is that the free maternal and the free under 5. Free under 5 means free treatment for children under the age of 5.
Yeah.
Any child above 5, they can pay. But the one under the age of 5, because we notice that that's a vulnerable years for those children. Yeah. So the government is helping to take up the responsibility from the parents. It's free, 100%.
Okay, so if any health worker is
if you notice my last press briefing, I said that if there is any situation where anybody collects money, I dropped a number that they can call.
Yes,
they can report.
We'll share it as well.
It's free. And as I'm talking to you, in the last State Executive Council, approved 1.6 billion to clear up bills for free maternal and free under 5. Right. So why should they be collecting money? Okay. As of today, a lot of hospitals have gotten their money from that contributory that was shared across the state, including the tertiary institution, the primary healthcare, and the secondary healthcare. We have about 64 central and general hospitals across the state.
And someone was saying that FFC do collect money until we now notice that FFC belongs to the federal government. So state government doesn't even own.
FMC is under the federal government. What we run is state program.
Okay, so it's a state policy.
It's a state policy. FMC is under NHIS, National Health Insurance Scheme. Yeah. State government, we have this. We have our own contributory health insurance scheme
that guides Delta.
Yes.
And I noticed that for you to have this this benefit from the state government, you are supposed to have a free healthcare card.
Yes.
So in case of an emergency and the parents doesn't have that free healthcare card, are you saying that the child will not be attended to?
Most people will come. Most pregnant women. Let's start from pregnant women.
Okay.
Most pregnant women would come to register for their routine antenatal visit. So when you come for your first routine antenatal visit, you register. You get your card. You already, all your biodata, all your history is already with the hospital. So if you are coming for an emergency, you don't need to show your card. Say without your card, they will not attend to you because the hospital already have your history.
Yes.
For children under the age of 5, They will admit you, then you will register while on admission.
Okay,
Okay.
so we'll talk about because most of our topic now is more of the urban area.
Yes.
How is the health sector in the rural area?
As I'm talking to you now, there is renovation, massive renovation of health facility, primary health facility across the state. And all local governments in this state are benefiting from that renovation
Sure.
of 150 health centers.
Mhm.
As I'm talking to you now, those health centers that are being renovated, they will be fenced. Some that does not have a residential quarters, staff quarters, it will be built 2-bedroom staff quarter will be built from scratch. Then the health center itself will be renovated completely. So these are the things they will do. From the leaking roof, it will be changed. The ceiling will be changed. Plumbing work, total plumbing work will be done. Electricals will be done. So a lot is being done at the primary healthcare level. And of recent, we just uh, appointed over 100 health workers in the primary health level to support whatever the local
That they
government
have
is
it there,
doing.
yeah.
Because the local government, the primary health centers are directly under the local
Local
government.
government
Whatever we're doing at state level is to support
support the local
the
government.
local government level.
Okay,
So that, yes,
with now that the local government they have their own money, is this
autonomy.
yeah their own autonomy? Is the state going to withdraw from that support?
Primary health care is the fulcrum of health in any government.
Okay,
Primary health care, if primary health care is functioning, you solved the health problem by 80%. So you cannot leave that for only the local government. The state is doing a lot to support whatever is going on at the primary health level. So, like I told you, the state government is paying some some staffs, and up to today, we just engaged over 100 staff
in
that are going. You
addition,
can look at the impact advert that is going on. We just engaged over 100 staff. So the state government is strongly supporting the primary health level. Even the federal government, through basic healthcare provision fund, is also supporting the primary healthcare level.
so
So
the
not
local
all
government are having support
facility,
from both ways.
yes, not all facilities benefit from the federal government. In Delta State, we have about 260 basic healthcare provision facilities who are benefiting from the federal government. But the state government is chesting over 441 primary healthcare centers.
Above the
Yes,
federal government.
yes.
Wow.
Okay.
And the plenty talk, not the full basket. You know, you came prepared and you've answered a lot of questions that we need to know about, most especially these medium and small health workers that you're talking about,
Yes.
that you have shortage. And now we are having more centers that they will
That
train
can
them
train them in
and put
the,
them. So
yes.
we'll not be having those lacunas.
Mm.
And that's fine. And again, Delta una don hear from our commissioner of health. If una go hospital when your pikin na under 5, which is 5 years down to 0, na free. Una don hear am for commissioner of health mouth. If anybody dey request for payment, Delta state dey pay for una. Make una know that one now. And if una get any other question again, una can put am for our comment section, share, and definitely this our more agenda don let everybody know say we wan advance our health sector. And thank you to our commissioner of health. Him dey rush go somewhere, but he need to come answer una, make una hear im own side too for wetin the Delta state don dey do to advance our health. Until we go come una way again, make una share una problem and make una tell us the positive response wey we dey get for the state, if at all. To come una way again. This na how una see am with Mr. Jollof. Thank you very much, our
Thank you.
commissioner of health.